Hello, and welcome to Thyroid Bootcamp Houston. I'm Dr. Winstrom, a thoroughly repurposed MD. In this brief video, you will get an idea of what I will present in more detail at the Thyroid Bootcamp workshop. This is a 2-hour free educational opportunity for our whole community. The attendees will also be offered additional educational videos and emails periodically. Now let's begin with Christy's story. If you can relate to Christy's experience in any way, then yes, this workshop is definitely for you. And yes, it just might be your thyroid. Christy is a 36-year-old who previously was a very energetic and alive, productive young mother and housewife. About 6 years ago, she began to notice some general lack of stamina, fatigue, dry skin, constipation. Her hair was falling out, she had sleep and menstrual disturbances, and weight gain that would not come off despite her most valiant efforts. Of course, all of these are signs of low thyroid. Well, after being told by the 4th doctor that all her blood tests were normal, she was under too much stress, she was depressed, and just needed an antidepressant, Christy began to believe that it really was all in her head. Thankfully, her 5th doctor, who was a functional medicine doctor, ran a full thyroid panel including a screen for thyroid antibodies. And lo and behold, yes, Christy did have the extremely common autoimmune type of hypothyroidism, Hashimoto's thyroiditis, for which there are many natural remedies and a great deal of hope. So what is this Japanese-sounding malady? Well, Hashimoto's is a very common autoimmune disease, and about 80% of the time it's found to be related to gluten intolerance. It may not be curable, but is certainly very treatable, and since we know that one autoimmune disease frequently leads to others, all efforts should be made to bring it into remission. You are also asking, what is that functional medicine that you mentioned? Well, in interest of full disclosure, you should know that I was conventionally trained as a mainstream family physician and could very well have been one of Christy's first 4 doctors until I saw the light about 5 years ago. Since then, I've jumped ship from the if this symptom, then give that drug philosophy to the functional medicine approach of why do you have this symptom in the first place and what is the root cause. Personally, I find it a much more rewarding, logical, ethical, and exciting, albeit mentally challenging, approach to practicing medicine. We in functional medicine take very seriously our oath to first do no harm, and we believe in testing rather than guessing so that we have some basis for our recommendations. We know that the body is very capable of healing itself if we just give it the raw materials it needs and we aren't poisoning it with either toxic chemicals or drugs or even foods. Like Hippocrates, we believe that all disease has inflammation as a root cause, and most, if not all, begin in the gut. Thus, to us, food is medicine. Unfortunately, Christy's story is just too common and so tragic for so many young families, all members of which suffer when, as the saying goes, when mama ain't happy, ain't nobody happy. It's our hope and our prayer that Thyroid Bootcamp Houston will help spread the word that yes, it still might be your thyroid, especially if some stones have been left unturned. But the thyroid is responsible for the energy production and function of every cell in the body. It affects and is affected by every system of the body in a mind-boggling, complex, and awesome feedback mechanism beyond any human supercomputer. Here's a very bare-bones version of this exquisite system. Starting up in the brain with the hypothalamus sending signals of a need for more energy to the pituitary, also in the brain, which in turn sends TSH, or thyroid-stimulating hormone, to the thyroid gland, asking it to make more T4, its predominant hormone. But please understand that T4 is useless until it is converted to T3, mainly by the liver and the intestines, and then it's taxied around the body bound to a protein. It can't enter the cell until it is released from this taxicab. So each one of these steps before the active hormone, free T3, enters the cell has a potential for something wrong. Each is a stone that may need to be turned to uncover a root cause for hypothyroidism. What all can go wrong? Well, starting with the brain, we could have brain dysfunction like tumors. Well, thankfully, these are very rare. Then the thyroid itself could fail to produce T4. Mostly this is due to lack of raw materials like iodine or zinc, iron, selenium, or due to the destruction of the thyroid cells themselves from infection or cysts or cancer or autoimmune antibodies. There could be poor conversion from T4 to T3 by the liver or the gut, or lack of enzymes and cofactors. But the most important of all is persistent high cortisol levels due to high stress. We in functional medicine know that we are just blowing in the wind if we're trying to fix the endocrine system if we haven't identified and addressed major stressors in our patients. Then there can be dysfunctional taxicabs, often due to estrogen sources like birth control pills or hormone replacement, or phytoestrogens found in soy, or endocrine disruptor chemicals like the PBAs in plastics. And lastly, but by no means least, and almost universally, is a lack of vitamin D. So what tests are most commonly needed to get at the root cause? Well, first and foremost, certainly a full thyroid panel, which consists of a TSH, T3, T4, a free T3 and T4, and a reverse T3, plus, of course, the all-important thyroid antibodies. Then a micronutrient test may well be done by culturing your cells, not just what's floating in the serum, to find deficiency states before recommending supplements. Food and chemical allergy testing for other sources of inflammation, and genetic testing for gluten intolerance frequently is done. If thyroid antibodies are found, however, we often also test for foods that commonly cross-react with wheat gluten. So there you have it, an overview. If you or someone you love has been struggling with symptoms that could be due to low thyroid, please invite them to come. There will be a spirited, interactive question and answer period after the presentation, and light, healthy refreshments will be served. So don't settle for a drug or a Band-Aid. Learn what should be done and then advocate for yourself to get it done. Join us in our passion, not just to help others, but to help them become the best version of themselves, fulfilling all their God-given purpose. Thank you, and hope to see you at our future workshop. If you would prefer to have a private consultation, you can schedule one on our website, www.oldfashioneddoc.com.